Patients often ask me, Doctor, why do I need to go for eye checkups and urine examination and bloods every so often? I'm actually feeling absolutely fine and I have no symptoms. Well, the answer to that is if you have symptoms, you're probably too late into your complications anyway. So our aim is to actually try and prevent these complications happening which are related to diabetes. And there is a lot of data and plenty of studies done to show that if you are actually aggressive enough in the first few years of diagnosis of your diabetes, then all these nasty complications are very well preventable. So what are these complications anyway? I mean, we all know about diabetes related extremes of hyper or hypoglycemia. So patients are often rushed into the hospital with these complications when their sugars are too high or actually too low. But apart from that, diabetes can affect various systems in your body. Patients with diabetes are at increased risk of having heart attack or stroke or paralysis attack. But not only that, poor control of diabetes can affect their eyes and give complications from simple cataract to actually major significant bleed in the eye, leading to loss of vision. Diabetes can also affect kidneys in long term. And remember, creatinine goes high later on in the course. So there are certain tests which we can do to pick up early signs of kidney damage and prevent things progressing to dialysis. Diabetes patients often complain of things like tingling numbness in their hands or burning sensation in the feet, which is often disturbing at night. And this is called as neuropathy. But one of the most dreadful complications I feel, and our patients also agree, is something called as peripheral vascular disease, where diabetes can actually affect the big blood vessels in the legs and actually cause problems with circulation and lead to gangrene. And often patients end up having amputation done. And this is preventable. Diabetes can make somebody prone to get any infection. I mean, take skin infection or respiratory infections. And with COVID-19 going around, it's very important that you have good control of your sugars and keep the HbA1c under target. There are studies which show that diabetes can also make somebody prone to get things like Alzheimer's, dementia, or even certain forms of cancers. So let's have a look what complications are actually preventable and what tests or monitoring you can do every year to actually prevent these complications happening or pick up at early stage. So the first and foremost thing to say is take the control and be in charge of your own diabetes. So do your bit of blood sugar monitoring at home, especially if you're on insulin. Sticking to diet and exercise regime throughout is very important no matter what stage of diabetes you're in. Stopping smoking and limiting alcohol is equally crucial to prevent cardiac or heart complications and even diabetic foot complications. Make sure that you're getting your blood pressure and your weight checked regularly, and if required, medications for those. Your cholesterol needs to be addressed for sure, especially if you're over the age of 40, and talk to your doctor about the risk and need for statins. List of annual blood tests or certain tests that I'm going to mention, which you need to get it done every year. So, for example, the blood test must include HbA1c, which is your 3 months average blood sugar test, the lipid profile or cholesterol, which we just talked, and the third thing is kidney function test, which is your creatinine or something called as GFR. Another thing is urine for protein or albumin, which is the earliest sign that diabetes is actually affecting your kidneys. And there are things which we can do at this stage if there is a positive protein or albumin in your urine. So there are medications which we can give to prevent the progression or ending up on dialysis stage. Make sure that you're getting your eyes checked regularly with retinopathy screening. And if there are any signs of damage, laser treatment can help prevent loss of vision. And your ophthalmologist can actually tell you when is your next follow-up for your retinopathy. So make sure you are sticking to the advice. Diabetes foot checks are quite important, and your doctor or local clinic nurse can actually easily do that to make sure that there is no evidence of major nerve damage or foot ulcers. And also, checking for blood circulation. So, knowing all these things, you're actually able to take control of your own disease, and getting all these tests mean that you're actually trying to prevent complications of diabetes. All the best.